Okay, well, let's talk about homeopathy. How many of you are familiar with homeopathy? You used it? Okay. Well, good. Let's trade places. Give us a little. Okay, well, let's break it down. What does homeo mean? Come on, that's a buzzword today. What's the real basic mean? Homogenized milk. What does that mean?
One? Homeo? Isn't it one something?
Well, yeah, it's uniform. It's all the same. What do they do when they homogenize milk? They break down the butter fat so it doesn't separate. So homeo just means same. And what does pathos mean? I love my board. If I can erase it in a minute. What is pathos?
Sick?
Study.
Pathology.
Study of something.
What?
Disease?
Yeah. Pain. Suffering. Okay, so homeopathy just means similar. You get real close to the word, you can't tell what you're spelling. Similar suffering. That's where the word comes from. And it's based on the original work of a guy named Hahnemann, but it probably goes back further than that, where he found, and with his people he worked with, that if you gave people large doses of a substance, it would create what he called a symptom picture. In other words, his provers, he called them, would take large doses of something like quinine bark or other herbs or minerals, and then they'd record their symptoms. And then pretty soon they found that if you gave someone a very, very, very small dose of a substance that would cause a symptom picture in a large dose, you could fix the problem. Now, let me jump around here. A good example of that is this substance called Ipecac. You remember? Are you familiar with that? Yeah. It used to be that if you ingested something or you wanted to get someone to vomit, you'd give them you got these little vials. I still have some at home. A little vial of Ipecac, and you have someone drink it, and within a short period of time they will vomit. Well, they found that if someone was vomiting, if they gave them a homeopathic dose of Ipecac, you could frequently stop the vomiting. And the dose you give is so small that it's very, very, very safe. You can give very poisonous things. Some of the remedies are actually poisons from snakes and spiders and things like that, and it fixes those symptoms. But homeopathy is designed to treat the whole person, because some people, as you get into homeopathy, you realize that there's more to vomiting than vomiting. Now, when you first get into this, you think, oh, he's vomiting. Well, a homeopath would say, okay, what does the stuff look like? Has he vomited once, or is he vomiting every 2 or 3 minutes? I mean, does he have a pain in his stomach with the vomiting? Does he have a headache? Does he have chills? See, these are things that the homeopath tries to put together to get what is described as a symptom picture. And volumes have been written describing the symptom pictures of most homeopathic common ones, most homeopathic remedies. I've got in the other room, I've got a 10 or 12 volume set on symptom pictures. And it only describes the symptom pictures of maybe 30 or 40 homeopathic remedies, when in reality there's hundreds of homeopathic remedies. And in fact, we'll talk about a little later, you can make your own homeopathic remedy. It's a great thing. And the beauty of homeopathy excuse me, my little cough, is that it's almost universally safe. The doses, well, let's break it down a little further. So we've got similar suffering. There's two main principles involved with homeopathy. One is the law of what they call law of similars that we just described. That's the similar suffering. Then the law of the minimum dose. That means you want to give a very, 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 very small amount. And when I mean a small amount, I mean a real small amount. You think small amount, well, I'll just give 1 drop or 1 milligram, or but we're talking about, for example, a common homeopathic remedy is, and we'll talk about this, called a cell salt. And these are available at Fred Meyer and various places. Just happen to sell them next door near the market. But this is a remedy, and it's called NatPhos, which is sodium phosphate, 6X. And the 6X means you've taken 1 part of the NatPhos and you've diluted it 10 to the 6th time. So how would you translate 10 to the 6th mathematically?
10 times 10 times 10 times 10.
Give me a number.
I have 10 with 6 zeros.
Yeah, right. 10 with 6 zeros, which is 10 million. So there's 1 part of this to 10 million parts of, in this particular case, it would be lactose, milk sugar. Is that safe? Well, sure, it's safe. One of the criticisms in traditional medicine is that there's nothing there. But many the techniques they use in quote modern medicine is you take something like this homeopathic remedy, and this has even a smaller dilution, and they analyze it. We used to make allergy drops. Grass pollen and mold and all sorts of things in a little vial like this. And some people showed it to their doctors, and their doctors took it to their lab, whatever kind of a lab they have, and they analyze it. And they'd say to the patient, "Oh, there's nothing there. It's just placebo effect." Well, it's been around for a long time, and it isn't placebo effect. In fact, they've studied homeopathic remedies at the University of California at Davis, and traditionally they make a homeopathic remedy by putting a little bit in a little bit of water and succussing it, they say. You move it in one direction and you change directions quickly, and you do that just by hitting it against your hand. Now, when you do that, you actually change the structure of the water molecule, and it's changed according to the substance you put in there with it. So there's science behind it. And you don't want to accept the science. But anyway, so it's very, very safe. You can give it to a brand new baby. In fact, our last 4 children were born at home. One of them looked kind of purple, and the delivery is kind of slow. But so as soon as this head was delivered, I gave him a dose of homeopathy. He's done fine. No problem. Pardon?
He's okay today?
He's great today. He's a little too big. He weighed 12 pounds when he was born.
Oh.
That's why he kind of got stuck. And so, very, very small. And the classical homeopathic physicians will sometimes use what they call 10 to the 1 million dilution. So it's very, very, very tiny. No, it's more, 10 to 1,000 million, I'm sorry, billion. So it's a huge solution. But you don't do those. You don't need to worry about those because you aren't going to be into that sort of situation. You can't really buy those very easily. You can't get them. Okay, so the law of similars, similar symptoms, and the smallest dose. Safe. Now, when you use this, I'll pass this around. If you haven't experienced, you can take one of them. When you use this, the bottles say, in deference to most of us, our thinking is that one little pellet can't do me much good. So they say take 4, when all you really need is 1. And so this bottle has 500 tabula, 500 doses. It costs you about $12, $15. So it's very, very inexpensive. So the beauty of the whole system, if you're willing to put the effort into using it, is that it's very, very safe, and it's very, very inexpensive. And once you get familiar with it and use it regularly, you'll find it's very, very effective. I've got a large family. We learned about this after when my oldest child was probably about 8 or 9. And in the last 40 years, I can't remember using antibiotics. We don't need to go to the doctor. Now, I'm a doctor, so I kind of neutralize some of that, but not all my training's been, you write a prescription, you give something from the drugstore. With this, you usually don't need to. But it takes, what's that saying? What's the price of happiness? I quote this all the time, people, come on. What's the price of happiness? What makes people happy? Freedom. If you're free, you can be happy. If you're free from ill health, if you're free from hunger, if you're free from government, you're going to be happy, aren't you? Okay, so the price of freedom is happiness. So what's the price of freedom? You got to be courageous. Now, it takes a lot of courage when someone's got a screaming with an earache or screaming with a bellyache to try and treat it yourself. And you got to use common sense. But I think we're approaching a situation where you aren't going to have a choice. You go to the doctor, if the doctor is open. What if there's a blizzard? What if Buffalo, New York, 6 feet of snow? You got to go to the doctor. What are you going to do? You aren't. You can't get out. If there's a flood, if the electricity's out, all these different scenarios that could easily happen. If you aren't prepared, people are going to suffer and die. So you've got to learn these things before the emergency, and you've got to have the courage to use them. You know? And you don't think so? Your grandson's there screaming, and his mother says, "Oh, we got to go to the doctor." And you say, "Oh, no, just take this little pill." That takes courage. But you practice on yourself, and maybe your husband or wife, and you get courageous.
It's like when someone else you love who's in pain, is not to react in fear and panic, but to assume that we can figure this out.
Yeah.
Having faith that we can figure this out rather than panic and in fear and having to call.
Well, yeah, but it's like the scenario I frequently comment on. If you're on a cruise ship and you don't know how to swim and it sinks, people are going to panic. But if you learn how to swim before you go, then you won't panic. You might be a little desperate, depending on how far away from shore you are, but you don't need to panic because you got some confidence. You build up some confidence, and you got some courage. Okay, so small doses. It's inexpensive and very effective. A good example, the thing that kind of converted my wife and I, we were, Christmas Eve, we had 4 children, 5, I don't know, maybe 5 children. And we were headed to Portland from Springfield for a Christmas dinner. And so we got the kids in the car, and we were all loaded up. As soon as we got in the car, my 4-year-old started screaming with his earache. What do? Go home and call the doctor, and the doctor will go to the emergency room. Yeah. Have you ever gone through that scenario? Isn't that fun? 3 hours later in the emergency room, oh, it's just about, take this, anyway. So we got our little homeopathic kit. You can get there's 12 different tissue salts, and we had our little kit. So we got our kit, and we had our little biochemic handbook. This book's worth thousands of dollars. Cost you about $12. Anyway, we got our kit, we got our book, and we got in the car. And we were in Springfield, headed to Portland. Well, we looked in the book, earache, which side? Is his face red? Does he have a fever? Is he coughing? Those are the things you you match up in here. Well, we tried one or two remedies and nothing seemed to happen, and we got on the freeway, and so we tried another one and got on the freeway, and before we got to Coburg, he quit crying. It was that quick. And he never cried again. We went to Portland, ate a lot of candy, stayed up too late, got back late, Christmas, excitement. He never complained again about an earache. It cured it. Now, Kurt back here would probably just put peroxide in his ear, and that may have worked too. But that's how effective it can be. Another good example. My wife's cousin, we questioned his sanity, but he got into a friend's homemade airplane. He was flying over Eugene, and the engine quit because the guy forgot how to transfer fuel tanks. Anyway, and his wife watched as the plane disappeared behind the hill. Well, they went out and rescued him, and physically he didn't appear to be hurt. They did X-rays, and he was awake, and but he couldn't talk. He was unable to talk, and they put him in the hospital. They did MRIs in his head. They kept examining, kept him there for observation. 2 days later, he still wasn't talking. So I heard about it, and I talked to a fellow in Eugene that was doing homeopathy, and he said, as he asked me questions about it, he said, well, what would you imagine was his feeling right before the plane crashed? And what would you say?
Terror.
Panic.
Terror, fear. That's right. Here's his airplane crashing.
Shock.
Well, okay, so there's a traditional homeopathic remedy called aconite. I can't remember what it is in the real world, but aconite is something that's traditionally prescribed for fear. So if someone's going to have to give a talk or some major presentation before a large group or whatever that would produce fear, this is what you would give them prior to this. Well, so we got some aconite and took it to the hospital, and surreptitiously, we didn't ask, I shouldn't say that. We gave him a dose of aconite. And about an hour later, we gave him another dose. And within an hour, he started talking again. I mean, it's just amazing. One more example, then I'll quit. A fellow came to see me when I was practicing with nosebleeds. And he'd had nosebleeds for a year. He had been to the doctor. They had cauterized him. They had put him in the hospital and done all sorts of things. He had to have a transfusion because it just kept bleed and then it stopped. Then it bleed and then it stopped. Now, if you look in here, under nosebleeds or any abnormal bleeding, there's a remedy called ferrum phosphoricum. And that's just iron phosphate. So we said, well, you might want to try this. Here's a book. You can look at it and see what you think. He was desperate. And he was a little suspicious. No, I'm not sure what he had spent by that time, but I'm sure it's close to $20,000, $30,000. How many times does it cost you to, anyway? So he took it home. And within 2 days, he called me back that it stopped. Did this do it? I don't know. He tried everything else. So he had a little bit of bleeding periodically, and he'd take Fairphos, and then I never heard from him again. Fixed it. So that's the sort of thing you have the potential to do. So it's really worthwhile. Now there's all sorts of, there's books and books and volumes but the best thing to do is start right here. Just start with this. Okay, what am I supposed to be telling you? Okay. Yeah, here's a list of books, but you don't really need them. Now, on the bottom of that front page, I've got some, if you want to keep reading. The ones, I probably wouldn't suggest that first one. That's big and thick, and maybe after a year or two you might want to get it. But the book Homeopathic Medicine is Home. It's a great book for getting involved in it, because it's got remedies for cough, it's got remedies for sore throats, it's got remedy for women's problems. It's got remedies, and those are the more standard homeopathic remedies. That's a good little book. Now, I've got two websites there. Scratch off the first one. I meant to do that, but just scratch it off. You don't need that little mark between the H and the P. It's www.hpathy.com. Now that's a homeopathic journal. It's online, it's free, and every month they put out it. Now, of course, it's for people that have been practicing homeopathy for a while. But if you look at the table of contents, there's also quite a variety of articles for people that are learning and are new. And I think it really helps to read about the patient whose migraine headaches were cured, or their epilepsy was cured, or their cancer went away. Because you read that, and it gives you some confidence that maybe there's more to this than just treating my sore throat. So reading what people are accomplishing with homeopathy helps you develop confidence in it and courage. But look at that website at least. It's okay. And there's one other, I don't know if I put it in here. There's an outfit called Homeopathic Education Services. That's an online place you can get books, and you can get most homeopathic remedies if you can't find them locally. Homeopathic Education Services.com, I think it is. Okay. Now on the next page, I gave you that little story about Ipecac. And then there's another one I put in here, opium. You can actually get opium homeopathically without a prescription. but it won't give you a high, but it might work. Let me tell you about my own experience. I had a herniated disc 20 years ago, 21 years ago, something. Herniated disc is where you get a bulge in your vertebrae. It pinches a nerve that's very unpleasant. You get it in the leg, it's called sciatica. It can cause all sorts of trouble. I lost the use of this arm. It was very, very weak and very, very painful, and my muscles kind of started disappearing because I couldn't use my arm. So I went to the doctor. I said, we better do surgery because I had the MRI on. Well, I just read about colchicine shrinking a herniated disc. So I thought, well, I'm going to try that first because I don't want surgery, And of course the surgeon said, well, that's kind of risky, taking colchicine. And it's an old gout medicine that's been around for 30 or 40 years. I thought, I'm going to take that risk rather than go to the hospital. So I took IV colchicine and it worked. It cured my herniated disc. And now 23 years later, I'm fine. But occasionally I still get symptoms that suggest to me the disc isn't totally gone away. I get a little fuzzy feeling in my finger, or I get a little pain in my arm. And so I thought to myself, I'm going to take the pill for him. And so I took the pill for him and it helps. So then I thought, why don't I try it homeopathically? So I got you can go online, you can get colchicine homeopathically, and we have a way of making homeopathic doses of colchicine. So I tried it homeopathically, and it fixes my symptoms too. Now, would it have fixed the pain in the neck? I don't know. But I do know that right now, I can control it by taking homeopathic colchicine. So to me, it was a real eye-opener, because now I've got another way of treating it without doing the prescription. And you don't have to go to a doctor, and you have to do all these things. Okay, like I said earlier, homeopathic remedies, that's what they call them. Just about everything you can imagine. It's made from animals, from vegetables, from minerals. If you can think of it, someone's probably made a homeopathic remedy and gone through what they call the provings, where they list the symptoms that develop in a healthy person when they take large amounts of the substance. How does it work? Well, I don't know. I don't think anybody can tell us exactly why it works. It's energy. It's some sort of energy transfer that your body can use to fix something. Now, I guess I'll give you one more personal experience. My children and I used to run in this, there's a local race they have on the 4th of July. It's called the Butte to Butte. It's a little race. They go from 10th and Donald Street up over the hill and down to Skinner's Park. And it's a fun thing. My kids and I used to do it. And one year, there were 3 or 4 of us running, and we were running. I think my daughter was 12 or 13. She twisted her ankle. She hit a rock or something, and she wanted to stop running. And I said, okay, Beth, why don't we try this? I said, why don't you think about taking arnica? Now, arnica is another traditional homeopathic remedy that is for injuries. So when you get injured, you take arnica, and oftentimes it'll make it better. So I said, Beth, think about taking arnica. Think about putting one of those little pellets under your tongue. Think about what it used to taste like. Say the word arnica in your brain over and over again, and let's see what happens. So she started doing that. And then after a few seconds, or maybe 30 seconds, I said, okay, let's start walking. And so we started walking. I said, well, how are you doing? She said, oh, I guess I'm okay. And I said, okay, let's jog a little bit. So we started jogging a little bit. And she was fine. She didn't complain again. Now, would it have gotten better on its own? I don't know. But I don't think sometimes that you really even have to take the stuff if you can image it and visualize it and tell your body what you want it to respond to. Now, that's kind of crazy, but I think if we keep these things in mind, we can begin to appreciate how homeopathy works. It's a transfer of energy, and that's the critical part of getting better. How do people get better when they visualize getting better? How does hypnosis work? And a lot of people say, well, how does this stuff work? There's nothing there, but it works. We can argue and debate, and if you don't want to believe it, that's fine. We're not here to force anybody into a belief system. We're here to explain to you a possible alternative to what you may be doing. Okay, so how does it work? We're not sure. Who discovered homeopathy anyway? Well, let's talk a little bit about what we call cell salts or tissue salts. And that's probably the best place to get started. Because here again, it's inexpensive, it's readily available, and it's cheap, and it works. Now, almost always you need a book like this. Now, I put in here a brief summary. There's that little graph. Well, maybe mine doesn't have it. You have no, that's not the one. I guess our copy machine's out of service. Oh, no. Well, I'll get one before you leave. But just a graph that has the 12 tissue salts in it. And let me
Could you hold that book up so I can?
Yeah, sure.
Okay, there we go.
Let me just run next door. I know where one is. I thought I had it.
Handbook. Okay.
Okay.
All
Just
right.
maybe pause that for a minute. We're going to get printed up some copies of this. Now, this over here on the left-hand side is the name of the tissue salt. There's 12 of them. It tells you different things they do. The body parts affected. It tells you the function, and it gives you symptoms of a deficiency in that particular cell salt. Now, we'll make sure you each get a copy, but the material's pretty much in this book. My son will be here in a minute to go get him a copy. Now, the way you use the book is really pretty simple. Let's talk about women's problems, because it works wonders for menstrual cramps. Because we're talking wrong class. Okay, but if we let's look at headaches, for example. That may be more appropriate for this group. Okay, you just go in the back of the book and look up headaches. And then under headaches, it tells you where to go to page 48. And on page 48, it talks about headaches. Gives you a little description of various types of headaches. And then on the next page, It describes each of the different tissue salts and what type of a headache they can help. For example, the NatPhos headache. It's an inflammatory headache from colds or sun heat with throbbing in the temples and over the eyes. It's a congestive headache at the menstrual period, soreness of the scalp. So what you try and do is match your symptoms with as many of these as you can. Now, if it's a Kali salt headache, it's worse in a heated room and in the evening. So you gotta pay attention to your symptoms. And actually what happens is when you start using this, you become a better patient. Because if you go to any doctor, the more details you can give that doctor about your symptoms, the more likely he is to be able to help you. Now, unfortunately, most doctors, headache is a headache. You know, they may say, well, is it a migraine? You have a funny lights before you get it, or is it? But most of the time, a headache or a bellyache or a sore joint, it's just that. They don't get into the details. But this has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different types of headaches. And it's your job. And the way you use this, you'd say, okay, I think it's a dull, heavy headache, and I'm drowsy when I get it. But I sleep and I don't feel refreshed. Okay? And so you try that. That remedy is I think it's Nat Muir, which is, what is Nat Muir? It's salt, sodium chloride. And so you take it and you try it 1 or 2 doses, and initially you usually try these things every 5 or 6, 10 minutes. There's no pattern. You can do it. You can take the whole bottle at once. You waste your time and money, but so you take it every 5 or 10 minutes. After 3 or 4 doses, if you haven't noticed any improvement, you get your book back out. And then you say, well, no, maybe it's not quite that. Maybe I should try this one. So you try that one. Or you might try NatPhos and CaliPhos. Every 10 minutes, go back and forth. See, there's no pattern. You aren't going to overdose, and you aren't going to harm yourself. And you pay attention until you experiment until you find the one that works. One of the best remedies is for if you have a daughter or a granddaughter that's menstrual problems. You know, the traditional treatment for menstrual problems is menstrual cramps in 16-year-old girls. Birth control pills. It kills them. Not literally. There's 4 or 5 videos out now on YouTube. The pill kills. And it's well documented that women on birth control pills die more often than women not on birth control pills. So anyway, that's kind of the choice most people are given. And most people go to the doctor and the doctor says, this is what you need to do, and they say, okay. But if you can offer them an alternative, and don't be upset if they say no thank you. They go out and kill themselves. No, they don't. They'll never do that. But that's, you know, practically speaking, that's what happens. People don't like this stuff, they're afraid to use it, and they go out and they really, literally die. Okay, so that's how you use it. It's very simple. You have to kind of get used to their vocabulary. It isn't the one we're usually used to. You know, they don't talk about arthritis, or they don't talk about stomachache. They call biliousness. You know what that means? You got GI symptoms. You burp and you belch and you pass gas, and your upset stomach. It's called biliousness. But it's got all sorts of things. Acidity, anemia, animals, arteries, assimilation, asthma, bedwetting, biliousness, insect bites. It just covers almost everything. Yes.
Would it cover like a back pain or a toothache at all?
Well, let's look. When in doubt, Backache Remedies, page 114. Here, I've sold a copy. He's going to buy it. No, I'm joking. Yeah, it's got all sorts of back and cracking of joints, enlargement of joints, painful joints, lumbago. You know what that is? Lumbar is the lower part of your back. lumbago is when that part of your back is giving you trouble. It's got several. Lumbago from straining, lumbago with dragging pains, rheumatism acute, sciatica, that's when the pain in your back goes down your legs. It's got several things that might fit back. Now, for the best thing for toothache, I think it probably has something here for toothache, but I think the best thing for a toothache, what would you guys do for a toothache?
Clove? A clove on it?
Clove, oil of clove is a great thing. Hydrogen peroxide, coconut oil. Put a teaspoon or tablespoon, you can't overdose it, put a tablespoon of coconut oil and suck on it. Hold it in your mouth as long as you can. You can repeat it every half hour or so. And almost a high rate of success. One example, my daughter had a crown with the root canal and she got a toothache in it. Guess what that means?
Expensive.
That's expensive. They take the crown out, they redo the tooth, and because they're trying to save the tooth because it's a very profitable tooth. She didn't have the money to do that, so she sucked on coconut oil, and with a day the pain went away, and it hasn't come back.
Wow.
Is it harmful to digest a certain amount of hydrogen peroxide?
No.
No,
There's a whole there was a traveling circus, so to speak. I say that facetiously, but the guy was doing a lot of good. He said, do you take 35% peroxide, you start with 1 drop in a glass of water, you drink that twice a day, then the next day you go to 2 drops, and you go up to about 20 drops in a glass of water twice a day. Then you go back down. And he claimed, now there's it's not written in the medical journals, but he claimed all sorts of things got better doing that. Because you have to think about, what is hydrogen peroxide?
Double oxygen.
Yeah, it's oxygen with a little hydrogen, a little extra hydrogen on it. It's not H2O, it's H2O2. And so when it gets in contact with this catalase enzyme, it breaks into oxygen and water. Now, you have to be careful with peroxide because it'll oxidize organic material. So you want to take it on an empty stomach. But we use it intravenously, we use it in the ear, people drink it, you put it on your skin. It's very, very safe if you use it properly. But 35%, it can be toxic. So you gotta be careful of that. It'll kill warts, but you gotta be careful. But anyway, what were we talking about?
Toothaches.
Toothache. Okay, yes, but yeah, there's things in here for toothaches. Throat symptoms, teeth symptoms. Yeah, thank you very much. Okay, so before you leave, you can pick up one of these things that cover the cell salts. Okay, so you just have to learn to use it, and you have to practice it. But it just does amazing things. Kidney stone pain, gallbladder pain, just. But you have to have the book, and you have to have some of the cell salts. So, what we usually recommend people do is kind of look things though. There's a few of the cell salts that people use much more than the other one. One's called ferrophos, iron phosphate. I have to think of this other thing. A cousin of ours cut off the tip of his finger. Have anybody ever experienced that? How painful, it's very painful, and it bleeds like crazy. He sucked on 4 or 5 tablets of ferrophos and just put a little paste over the end of his finger. The pain went away and it stopped bleeding. You think, and it can't work. It does work. But if you didn't have ferrophos, you'd have trouble. Okay. Questions?
Do these tissue salts have a shelf life?
No. Like anything, traditionally you say about homeopathy, you don't put them next to magnets, you don't put them on top of your TV or your microwave. You should keep them in out of direct sunlight. You should keep them kind of protected. But I've had some for 20 years, and they still seem to work. Okay, don't worry about the dose. There's some commercial products are 6x, some are 12x, some are 15x. Don't worry about that. Some are even 30x, 60x. The ones you're going to get in most places like here or online, they aren't going to be the 60x or 500x or things like that. You know, and those theoretically, they say if you give a high enough potency, a great enough dilution, you can actually recreate the symptoms. Now, I'm not sure. That's called proving it. I've never experienced that, so, but it's just something to be aware of. But for the vast majority, for all the people in this room that are going to be using homeopathy, you don't really need to worry about it. Or people that may happen to see this video, you don't really need to worry too much about that. Okay, if we turn the page again, a few tips for homeopathic remedies. Your mouth should be clean. If you're drinking coffee, traditionally, historically, when they say, if you're drinking coffee, it'll neutralize homeopathic remedies. That may be so, I don't know. If you've been drinking coffee and you really want to take a homeopathic remedy, take it anyway, quit drinking the coffee, rinse your mouth out. Your mouth should be clean, because if it isn't, it may not work as effectively. Okay, I don't necessarily agree with these. There's an interesting, like every other profession or study, there are the purists, and then there's the people that are a little more relaxed about it. Now, for years, the homeopathic physicians were purists. You take one remedy, and you don't take anything else, and then you come back in a day or a week or a month, and then we'll see if it's affected you. And that went on for a long time. But then these same companies started coming out with combination remedies. They have 5 or 6, or you can actually, maybe I have one here, get a flu remedy that has 6 or 8 different homeopathic substances in it in several different doses. And they say it works. Well, that kind of contradicts the first theory, and I kind of tend to go along with the second theory, because we've had such good success with this kind of custom-made homeopathic remedy that has about 1,200 different things in it, and each thing has 50 different potencies. In other words, there's 6x, and there's 12x, and there's 15x, and there's 60x. It just got the whole thing in there. So actually, there's several thousand different homeopathic remedies. And the beauty of homeopathy and the beauty of our body is, let me put it this way. Let's say you were on a real strict diet. You're on a paleo diet, or you're on a gluten-free diet, or you're on the Atkins diet. Now, if you went to a cafeteria, the more choices you had, the more likely it is you're going to find what you need to eat. Is that correct? Mm-hmm. If I just had 6 things there, if I went down to Burrito Bob's down here, I wouldn't be able to find it, what I need, as more readily as I would be able to if I went to, I don't know where you go.
Hometown.
Pardon?
Hometown buffet.
Hometown buffet, okay. And so the more things available, see, your body has the ability with homeopathic remedies to utilize what's there if the right thing is there and ignore everything else. See, if you're really disciplined and you're on a paleo diet, you can go to the biggest buffet in the world and you could stick to your diet. And our bodies are able to stick to their diet if we give them that opportunity. And so the more you have available, the more likely your body is going to get benefit from this. And that's why people that have food allergies or mold allergies or whatever other chemical allergy get relief from this, because the thing they need is in there. And so the idea that you can only take one thing at a time, this one rule here, all other remedies should be avoided. I don't necessarily believe that. But you can find out for yourself. Okay, number 4, continue the remedy until you start getting better. Let's say I've got a headache, so I take a remedy, and nothing happens. So I take it again, and then after about 4 doses, after about half hour, an hour, I start to get better. Okay, I might repeat the remedy again. I might keep repeating the remedy. And the other thing you might notice when you do homeopathy, like an earache or something like that, you get better, and you reach kind of a plateau. Well, my headache's gone, but my throat's still a little bit sore, and I've still got a little bit of fever. Well, then you find a remedy that matches your new symptoms, and you keep working on it. Sometimes it's a step at a time until you find until you're well, until the symptoms go away. One of the best remedies for croup, whooping cough, is homeopathy. Have you had children that had whooping cough? You know how they wake up with that typical bark. It's very typical. If you ever heard it, you won't forget it. It's like a little puppy. It's a sharp, quick bark. Well, there's a remedy for that, and I think it's aconite. But then the traditional homeopathic pattern for treating croup or whooping cough is you give one remedy until that bark goes away, then you give it one called spongia, and that treats the next layer of symptom, and usually within 24 hours the child's well. And that's in books like Homeopathic Remedies at Home, or Homeopathy for the Family, or something like that. Family Guide to Homeopathy. They go into those things there. Oh, so you continue giving the remedy until the improvement. They say reduce the frequency of the interval, or increase the interval between doses. Okay. Remedies have an indefinite shelf life if handled and stored properly. Best to keep them in their original container. That's not absolute. If you've got a family member, somebody that needs a remedy, and you've just got one bottle, what are you going to do? Give them the bottle? Nope, not me. I'm going to put some remedy in an envelope or in another container, let them take it home. And in a pinch, what you can do, if you happen to, and that's why I think you ought to have a few of these little dropper bottles at home. You can put one remedy, one pill in here, fill it with water, filtered water preferably, and hit it 50 to 100 times, and you got a whole bottle. A friend of mine experienced this last summer even. They had some hay fever symptoms. They saw a remedy at some doctor's office, and they took the remedy and it worked. They felt much better. So what they did, they put one of those pills in the bottle, made a homeopathic solution, and one pill became 500 pills. Price went down. It was $13 or $15 for a dozen or two pills. One of those pills, in a bottle like this, you have at least 500 doses, and it worked. And so you can put one of these in a bottle and send it home with someone, or you can give them a few. So it's probably best for long-term storage to keep them in the original container, but it's not absolute. And don't give your bottles away. It's like giving your favorite tool away. Keep it on a long string. Okay, keep remedies away from strong things. Now, keep out of the reach of the children. The only reason for that is because they waste them. We had a kit with 12 of these remedies. I had a daughter get into them, ate about 4 or 5 of the bottles, the whole bottle. She didn't get any symptoms, except my anger. But they're good. They take, you tasted it. They're easy to take. Kids love taking them. So you have to keep them out of the reach of kids. So they just take them all. Okay, keep in mind the elimination of a symptom may unmask other symptoms. So the homeopathics describe illness as an onion. That you have an outer layer of symptoms, and you get rid of that outer layer, there's another layer. And sometimes you have to go down through several layers before someone really feels well. Okay, now you can make your own homeopathic remedies. In a pinch, let's say, well, you didn't believe what I'm saying here today, and so you just went home, and tomorrow the electricity's gone. And your grandkid's staying with you, and he's got an earache. What are you going to do? You're going to panic and say, what if I'd done what he said? But you see, you can take any body fluid. You can take saliva. You can take, let's say someone has bad pink eye. You can take a Q-tip or something and get a little of that gick from the eye. You can take urine. Now, as gross as it sounds, if someone's having bad diarrhea, you can take a Q-tip and dip it in the toilet of the person that had the diarrhea. That takes courage. That's what we talk about, courage. But it'll work. And if you, then what do you do with it? Well, you take the spit or the urine or the gick from the eye, and you put it in a little bottle like this. And you can put the Q-tip in there and break it off. Fill it with water, or 2/3 full of water, and then take the Q-tip off because you've inoculated that fluid. Okay? Then, like I've described here, I better say it the right way. Okay, you fill it with water and you put the initial thing in there. Let's say you fill it with urine. Okay, then you just pour it out. Now, if you use a Q-tip, you don't need to do this first step, but you pour the fluid out. Now, it's not empty. If you look carefully, you'll see the lining of the bottle is coated with that material. Then you fill it up 2/3 with water, and then you succuss it. How many times? Traditionally they say 100, but you read where it says 50 or whatever. You do it wherever you feel good at. And then take the top off and pour it out again. And you keep just what's left in there. You fill it up again. You do that 5 or 6 times. And after you've done it the 6th time or the 5th time, you have a homeopathic remedy. Of the saliva, of the tear, of the snot, of what the guy's coughing up, of the stool sample, of a urine sample. You've got a homeopathic remedy very specifically for that condition.
Have you ever cured colitis with that?
Never tried. I probably wouldn't try this on its own, but if I was in the middle of some sort of emergency and someone had diarrhea, I'd probably try it. But in that situation, if you're totally grossed out about doing a Q-tip in the toilet, have the person spit or get a little blood sample and use that. In fact, there's actually a homeopathic where you draw a blood sample and you put it in here and do this, keep it kind of sterile, and you do it intravenously, and it works. That's a remedy for infertility. You can take a urine sample from both the partners and make a homeopathic remedy for it, and then they take a drop of this under their tongue, and people get pregnant. It's amazing stuff. Homeopathy is amazing stuff. But you gotta get into it. And either one of these books is another good this isn't really a good introduction to homeopathy in the sense that some of these other books are, but it's a good practical book. If you want to delve more into the traditional homeopathy, get either Homeopathic Medicine at Home by Panis or The Family Guide to Homeopathy. I'm sure you get either one of them on Amazon. But that gives you a little more background, a little more of the theory. But, okay. Okay, so just a few precautions. Don't use distilled water. I think it's best to use filtered water, but distilled water is so devoid of everything. That's not the way water is supposed to be. It should have some minerals in it. What I prefer is you get bottled water and then you put a pinch of sea salt in it, and maybe a little baking soda, and maybe a squirt of magnesium chloride. Anyway, give the water a little life. Sea salt's one of the best things to add to water. If you have drinking water at home, put a pinch of sea salt in it. If you use bottled water, put a pinch of sea salt in it. We're all mineral deficient. That's a good way to get some back in. Now, here again, same things. Don't use real hot water. Don't put it in sunlight, and avoid touching the dropper remedy. But, some people are so, OCD, you might say, a little so compulsive. If the dropper touches their tongue, they throw it out. No, don't do that. Just be careful with it. Don't totally contaminate. And you might even see, if you've stored it for a while, you might even open it up and you see it's a little cloudy in here, like there's a little fungus growth in it. And there may be. Well, if what you do, suck some hydrogen peroxide up there and leave it there for a few minutes, and then wash it out a few times, and you're okay. So you got to be relaxed a little bit. Don't be so. Okay. Now, on this back page, what I did, I think we have this one. It shows how a homeopathic doctor might approach a case of cold or flu or something like that. This is put together by Dr. Messer that used to live in Eugene, and I just think it's really, okay, let's say you have flu symptoms, and everybody says, oh, I got the flu. Okay, the first thing you say, is there a fever? See, and if there is a fever, it points you in one direction. If you don't have a fever, it points you in a little different direction. And this is how you have to deal with this. Okay, let's say there's a fever, okay? Then you go to belladonna, and you say, what's belladonna? Okay, that's where you need to do a little homework. In homeopathy, there's a term they use is called polycrest. Now that's, of all the hundreds of homeopathic remedies, a polycrest is one that fits a whole lot of different conditions. And the feeling is there's about 30 or 40 polycrests out of the hundreds of remedies. And if you understand these polycrests, in fact, there's actually books written on the polycrests. If you understand the polycrests, then you're going to be able to treat about 80% of the things you come in contact with. There are a few weird ones that won't cover it, but for the most part, if you understand arnica and lycopodium and ipecac and ignatia and ferrophos and a few things like that, you're going to be able to treat so many things. And so when you come to a word like belladonna, you say, what's belladonna? So you read a little bit about it. And then you get an idea. Belladonna is sudden onset, right side of the face turns red. And a daughter that needed that for her bedwetting, and it worked very well. Okay, so it's not belladonna, but it might be aconite or it might be ferrophos. So okay, but if it isn't, you don't have a fever, you go a different direction. Mostly cold symptoms, flu symptoms, cough predominate, and so as you follow the symptom map, so to speak, you were most likely to get to the proper remedy. And that takes a little bit. With the cell salt book, you don't have to worry too much about that. You just get out the book and start using it. You know, a 12-year-old, 10-year-old can use this book. I've got a nosebleed. So you look under nosebleeds, you look under nose symptoms. Nose symptoms on page 94.
Ferrophos.
Good job. You're paying attention. Yeah. I've got a daughter now. Oh, once a month she wakes up with a bloody pillow. Well, if she takes her ferrophos, it doesn't happen. It's just a great remedy. And it works. But you go to a doctor and says, my daughter has a nosebleed every 3 weeks. What's he going to do? Well, not these days, they'll send you to a specialist. There's another couple $100. And what's a specialist going to do? He's going to look in there and pat you on the head. Oh, it'll probably be okay. I mean, you save yourself so much energy and time and money. Going to a doctor these days is at least a half a day of your life. So anyway, get involved. Read the book. Get a copy of the Biochemic Handbook.
What's the author's name?
Pardon?
What's the author's name of the Biochemic
There's
Handbook?
I don't think there is an author.
Oh, no.
No, it's so old that it's been around 30 or 40 years. Used to be Schussler's. Anyway, we try and keep them in stock next door. It literally, I'm sure it saved my family tens of thousands of dollars.
How much the kits are?
Yeah, good stuff. Okay, any questions? Great, good class. Next week, if you're here and I ask you a question. I won't ask about nosebleeds though. That's too easy. Okay, great. Okay, but do it now. No, I know you're going to do it, but do it now. Someone once said, when should we repent? You better do it now, because you never know when your last breath is. Okay. What the doctors label you? Asthma?
Yes.
Yeah. Well, look in the cell salt book. See what it says about asthma. Or if that doesn't, you don't find that what you might work for you then, look under breathing problems, shortness of breath.
The magnesium in water, shaking it up and spraying it, the mist spray.
That might work, you know, the magnesium chloride, okay? Here's a, good thing you come to this class, you get people in the audience. There's a magnesium chloride. Magnesium, see, will relax bronchial tubes. If you go into the hospital with an acute attack of asthma, they might give you a steroid, but they might give you IV magnesium chloride because magnesium relaxes the bronchial tubes. Now, you can you can make, this is magnesium chloride, and you can, one of our other classes we talked about making a solution that you can breathe. You take about 1.5 cc, 2 cc's of this and put it in this and distilled in filtered water. And then you just, well, this is just saline now. And then you just hold this, and this is a mist bottle. And see, if you squirt that, you see the mist? You just take a breath as you pump that, and you breathe that magnesium chloride right into your lungs. And doctors say that is as effective as taking it intravenously, because it gets right into the lungs and gets absorbed into the blood, and it's right there in the bronchial tubes that are in spasm. Now, would that fix you? I don't know, but it would cost you about $10 to get set up, and that's a lot cheaper than your prescription, and it won't interfere with your prescription, and you might find that if you do this regularly, you can do this 10 times a day. You aren't going to overdose. And then if it gets better, you might be able to take less medication. Don't know. But what you're doing now, and most people do when they go to the doctor for a condition, the doctor puts them on medication, which is not the reason you have the problem. You don't have that medication deficiency. And so you, whatever causes your problem just keeps getting worse, then you need more medication. Then it's a vicious cycle, a bad cycle.